What is Lewy body dementia? Let's talk about that. Many people might not be aware that Lewy body dementia is one of the most common forms or types of dementia, right after Alzheimer's disease, which is number 1, and vascular dementia, which is number 2. It usually begins rather early in life, around the age of 50, but it can occur even earlier. Lewy body dementia involves abnormal protein deposits. Again, proteins are behind most of these disorders. And those proteins are called Lewy bodies, which are balloon-like structures that form on the inside of cells. As the protein alpha-synuclein and other proteins build up, neurons degenerate and die. While initial symptoms of Lewy body dementia vary as the disease progresses, they will include cognitive, physical, behavioral, and sleep-related problems. Now, there are 2 related conditions. One is dementia with Lewy bodies. This is characterized by cognitive symptoms that are seen within a year of movement symptoms called Parkinsonism, which includes tremors, rigid muscles, difficulty walking, and posture, difficulty with posture. It is a form of progressive dementia that worsens over time. Other symptoms include loss of smell, sleeping difficulties, visual hallucinations that develop up to 10 years after the movement problems start. Some signs and symptoms can be confused as those of Alzheimer's disease. So this Lewy body does get confused with Alzheimer's quite a bit. The symptoms, memory loss, poor judgment, confusion, those are the same symptoms that you'll find with Alzheimer's disease. So it's not far-fetched that these two can be confused. And some of the symptoms are like those of Parkinson's disease, namely the movement problems. Now, the other related condition is Parkinson's disease dementia that falls under Lewy body dementia, and for good reasons. This dementia involves cognitive problems and symptoms that appear more than a year after the beginning of movement problems and occurs in people diagnosed with Parkinson's disease. This disease affects memory, language, social judgment, and reasoning. People with Parkinson's disease dementia have also been found to have Lewy bodies, amyloid plaques, and tau, all those proteins, just like those in people with Parkinson's and Alzheimer's. So you can see where this gets rather muddy and confusing. Symptoms of Lewy body dementia. There are numerous symptoms associated, including changes in thinking and reasoning, and confusion one day, but alertness the next. That is a hallmark difference between Lewy body dementia and Alzheimer's. Movement disorders also accompany the disease and include slowness in movement, imbalanced gait, and Parkinson's movements. The disease also produces hallucinations and delusions, sleeping difficulties and memory loss, and even symptoms more profound than Alzheimer's disease. Now, what about the causes and the risks? There are no known risks for developing Lewy body dementia. There are no genes that have been identified. No family history has been identified. We have no risk factors, in other words. Treatments. Just as there are no known causes, no known risks, there are no medications targeted specifically for the treatment of Lewy body dementia. Alzheimer's drugs, antipsychotic medications, antidepressants, Klonopin, things like that, they can be used for Lewy body dementia. My final thoughts. Lewy body dementia is among the 9 known types of dementia and ranks as the 3rd most common, after Alzheimer's disease and vascular dementia. One of the disease's hallmarks, Lewy bodies, are abnormal proteins that form on the inside of the brain cells. This protein, along with alpha-synuclein and other proteins, build up, leading to the degeneration and death of cells. There are no known risk factors, causes, or medications for Lewy body dementia. Hopefully, research and time will provide more answers and better treatments for people who need it. Thanks for stopping by. My name is Dr. Jim. This was my brief introduction and overview to Lewy body dementia.